I'm Dr. Adithya GK, surgical gastroenterologist practicing in Bangalore. Today, under the banner of gastrointestinal solutions, we will discuss one more important topic called gastroesophageal reflux disease. So, you must have heard this term gastroesophageal reflux disease. What is it? It is nothing but a reflux of either acid or alkali into your food pipe from the stomach. When you see the literature, 10 to 30% of the population will suffer from this kind of a problem once in their lifetime. So, what are the common symptoms of this GERD or gastroesophageal reflux disease? Usually, patients complain of chest pain, or there could be regurgitation of acid into their throat or into the chest. So, this causes pain. Also, it is associated with heartburn. So these are all usual symptoms. There could be some atypical symptoms or unusual symptoms. They are hoarseness of voice, or there could be chronic dry cough and patients will be keep on clearing their throat. There could be wheezing, and there could be difficulty in swallowing in some patients, and some patients may also complain of pain abdomen and belching. So why is it important to diagnose gastroesophageal reflux disease and treat it? There are few reasons why it needs to be diagnosed. One, because it resembles the other organ specific problems like cardiac problems, lung related problems, pulmonary problems can mimic the same way that of gastroesophageal reflux disease. That's why we need to diagnose it properly so that we can rule out other problems. Also, this needs to be diagnosed because over a long term period, this can give rise to complications. So, to avoid these complications, we need to diagnose it. And also, this diagnosis and treatment will definitely improve the quality of life of these patients, and it will increase their potential at work. So, when we talk about complications, what are the usual complications we are talking about? One is called stricture esophagitis. Because of chronic acid reflux, the food pipe gets fibrous. That means it becomes thickened, and there will be multiple ulcers forming on and off that causes narrowing of the esophagus. So, that narrowing itself gives rise to difficulty in swallowing. This can give rise to chronic chest pain, which will be almost indistinguishable from cardiac problems. There could be motility related. The movement of the food pipe itself can get damaged, and in some of the patients over a long term period can give rise to cancer development. So, what are the reasons for this gastroesophageal reflux disease, and why one should develop this kind of a reflux problem? The usual problems are loss of something called a lower esophageal sphincter pressure zone. So in the food pipe esophagus, in the lowermost part, there is a high pressure zone which is inside the abdomen, which prevents the reflux of acid. So in some of the patients, this pressure zone is lost. So once the pressure is negated, there will be more reflux of acid. So this can happen something called because of a crural diaphragmatic loosening. So there will be a diaphragmatic crura which becomes loose, and that can give rise to a reflux disease. Or there could be associated some motility disorders of the esophagus itself, which can give rise to gastroesophageal reflux disease. And in some patients who indulge themselves in long-term self-induced vomiting or gagging can also give rise to gastroesophageal reflux disease. And last but not the least, obesity is one of the very important causes of gastroesophageal reflux disease. So, what does trigger this reflux? So, the reflux is usually triggered by food we consume. So, important food items which can trigger this reflux disease are fried food, spicy food, and anything which contains caffeine, alcohol, carbonated drinks. In some patients, cold beverages can also trigger a reflux, and in some patients, onion, garlic, or even to some extent mint can uh, trigger a reflux. And an anxiety or a type A personality patients can also have this kind of reflux disease. So how do we diagnose this? So diagnosis is mainly depending on the type of symptoms. So a medical or a surgical gastroenterologist or any physician can diagnose gastroesophageal reflux disease based on patient symptoms, which goes on for a long time. And to document this, we need to get an endoscopy done. So endoscopy also gives some of the hints about gastroesophageal reflux disease. Also, in some of the patients where the diagnosis is in a dilemmatic phase, in them we need to get something called a 24-hour pH monitoring, plus in some patients esophageal manometric study. So these are the some of the tests which can be done to diagnose a reflux disease. So once it is diagnosed, we need to treat it. As I told you before, to prevent complications, we need to treat it, and make the patients better, we need to treat it. So initially these patients will get medical management. That is, we ask them to change their dietary habits and also some of the lifestyle changes, so which can improve their symptoms. And some patients require acid suppressive medicines like a proton pump inhibitor or antacids, in some of the patients prokinetics. So these are the medicines will help them to get back to their original life, and once it is under control, they need to carry on with their dietary and lifestyle modifications, which will keep them symptom free for a very long time. And some patients also require behavioral therapy because they will be under a lot of stress and anxiety, which needs even anti-anxiety medications, and they need behavioral therapy to come back to normal. This will go on for months together, maybe 2 to 3 months, sometimes 6 months or years together, to get them back to normal life. In some of the patients, the medical management may not help, or this medical management goes on for years together. So in these patients where they are fed up of taking medicines, and some patients who start developing side effects of medicines, or some of the patients who develop complications. As I told you before, if they develop something called a stricture esophagitis, where the esophagus starts to become narrowed, in these patients, surgery is advised. So as a surgeon, I usually counsel them for surgery before undertaking any kind of surgery. This surgery is called anti-reflux surgery. So in anti-reflux surgery, what happens is, as I told you before, there will be loosening of the crura. So this crural diaphragm is tightened. If at all there is a hiatus hernia or mobilization of the stomach into the thorax, it will be brought back and it will be kept in its original position, and a fundoplication is done. A fundoplication is where upper part of the stomach is wrapped around the lower food pipe to prevent any more reflux from happening. So we create a high pressure zone in the lower esophagus so that any more reflux will not happen. So these patients will respond very well to anti-reflux surgery, And in the current scenario, we have laparoscopic and robotic surgeries which are minimally invasive and which will keep the patient more active soon after the surgery, and there will be minimal pain and patients recover very well soon after the surgery and resume their work as soon as possible. So friends, please try to understand gastroesophageal reflux disease. It's a chronic condition which can give rise to complications, as I mentioned before. So to prevent these complications, we need to diagnose them timely and treat them. So please consult your gastroenterologist, either medical or surgical, if you have any of those symptoms, and get it treated before you will end up in complications. Please understand this video and you talk to your friends, relatives, or concerned ones if they have these symptoms, and give them this piece of knowledge and make their health better. Thank you very much.